I'd like to essentially do almost a direct continuation from our discussions from yesterday, the big sort of plenary debate. And I think the kind of feeling in the room was like, let's get on with this. Do we need to discuss whether we should or can achieve the SDGs? They're so important that we, and as Katerina said, we need to, the governments have signed up for this. So there's a consensus around this, but I also feel all the details laid out by Duncan and Ian and Louise and Stuart were very important. So this idea of getting on with things, but not neglecting the details, I think that's the real key to it. The other thing, and really this is what I'd like to talk to you about, is this, ever since January, I've been really interested in what countries, how they're responding to the SDG agenda, what they are thinking, feeling, what their readiness might be. And I think there's a lot of complexity here, but my thoughts are basically that they're very interested. They all have existing policies and strategies, many of which have preceded this time. And so it's a question of not necessarily saying we will have the full kind of roadmap of the SDGs starting from scratch, which is kind of a top-down approach, and which is many of us kind of think in terms of how we organize ourselves, but we've got to kind of adapt these to our own standards. So I guess what I'm trying to say is the very details that we talked about need to be communicated and we need to have a dialogue so that they can be adapted properly. Yay. Okay, so the goalposts have changed. We heard that. I mean, some of the math that we saw, which was really interesting yesterday, I quite enjoyed it. It was projections into the future. And I'm going to give you a few different kind of illustrations of the way numbers have changed myself. But it's not even going to be complicated like that. It's just how the actual, the baseline for the SDGs is going to change. I think we saw in many countries that they're looking at the MDGs and they see a sort of a constant line of progress, and they think that's where their baseline is going to restart, and they're sort of happily thinking we're going to make this, and that's not necessarily the case. So again, I think that when we do that exercise, we're going to see numbers essentially cut in half, which is a negative message. But what I'd like to show you is that it's kind of worth it. So the first and pretty much only thing that if you walk out of this is to really take home is this particular piece, and I hope everyone can read it. And I think this is really not sort of widely understood either, but this idea that a transition to safely managed services, and hold your breath a little bit on safely managed services. It means maybe sort of different things to different people, and there's precise definitions that the JMP offers, but this idea of, for example, a well-regulated water supply system that's sort of available and functional, and a complete, a sewerage system that works, or even community-managed excreta. That type of transition from improved to that safely managed can get you 60 to 70% diarrheal disease reductions. Now, for all your epidemiologists, it's true. There's, before getting too kind of, firm about this, there's only a few studies, but it does, if you look at the upper number, this 11 to 16%, it just shows you from a health perspective, we have to think about this transition to safely managed, right? Even if it's not necessarily applicable to all countries at a certain time. So this is the latter. We saw a little bit about this yesterday. And I'm not going to walk through the whole thing. I think many of you understand unimproved and improved, which is the JMP things. But what has happened on the top rung as far as the definitions? I think all of us wanted to see safely managed, for example, measuring management, measuring good practice, measuring, for example, water safety plans. And that's proved a little bit difficult. I think that's still potentially something that the countries might adapt and might be something down the road, but really it's being driven on the water side by direct water quality monitoring, so E. coli monitoring being integrated into household surveys, by availability, so countries being asked, householders being asked, was water not available for one day over the last 2 weeks? And this idea of being on premises, and there's a lot of debate about this because there's well-managed water on a communal basis in many parts of sub-Saharan Africa that's safely managed, but it is the definition, and it is on premises. And sanitation similarly debates about shared, not shared, but it's a private facility where the waste is safely treated, disposed of, going through a treatment center properly, or off-site, or managed properly on-site. So what happens to the numbers? Because I think all of you can imagine, they really get driven down. So this is a real country, which I won't name. And some of the numbers, are estimates, because we're trying to do the baseline now. But right now, this particular country has a 98% improved water supply. So they have happily achieved the MDGs and are doing very well. Yet, of that 98%, and let's just say that most of these are boreholes on this particular country. So there's the sort of what is more than 30 minutes takes about 3% off that. Again, on premises, 74%, so we start dropping even further. This idea of functional or available when needed. So if we take all the piped water supplies and say they're intermittent, which is often the case, but because there's few of them and it is driven by boreholes, it's not so much. And then E. coli, direct water quality monitoring, in this case really drives the numbers down. And this is actually in pipe supplies in this country. So this is in this kind of very interesting situation where you could have a piped water supply that is actually contaminated and driving safely managed down, which is worrying. And then so you get a number of 50%. So that's almost being cut in half in this particular country. And so this is a big chunk on sanitation. Many of you are familiar with the great work done by the WSP World Bank on excreta flows. In the diagrams, I'm not going to use the SFD word, sort of the inside joke. But we're seeing, so if you look at the left-hand side of this figure, you're going to see 74% of the country has improved water supply. And if you think about where that 74% is going, whether it's off-site or on-site, if it's off-site, the estimates of leakage or improper treatment drive it down, half of that going into the off-site. The on-site, a similar thing, even worse, and so you end up getting a number of about 34%. Or is it 30%? Anyway, but it's quite low. So that's the situation, and so the world's going to change. So this is just looking at E. coli. So all the accolades that we heard about, the MDG being achieved in 2010, I think we're going to have to somehow figure out that communication on a global level to do more. And on water, or on sanitation, of course, it's even worse. There has been some estimates and projections about, what the coverage will be. But I've just put question marks. Suffice to say, it will be cut at least by half. So that's the situation sort of globally. And but really what I wanted to talk to you about is how countries are kind of responding to the details, because it's the details and it's at the indicator level where I feel that the countries are going to need to wrestle with that to essentially influence their policies. So if you think about E. coli and fecal contamination in water, what is the response? The response isn't going to be necessarily just driving up numbers. It's going to be about improving management, which is a difficult thing to do. So the first message here is all that stuff I just told you. Many countries, and actually many of us, including myself at one point, didn't understand. All these indicators, we've made it quite complex, I think, for fairly good reasons. All right. So the other thing is that the countries find that elements of these indicators are actually very interesting to them, right? So it's just like when we've gone and when we've done these sort of sensitization workshops, there's a huge interest in improving surveillance systems. There's a huge interest in being better able to monitor. There's been, just a lot of sort of picking and choosing and saying, well, this might work for our new policy revision process. And I've named a couple of examples here. But there's really a tendency to sort of tweak or rebrand or adapt elements of their existing policy and indicators rather than kind of let's make this sort of radical change, that potentially many of us expect. So it's clear that national monitoring systems need to be changed and capacity needs to be built, right? And I do think that everyone we've spoken to, is suggesting that they would like to do better. I don't think that many of the technical folks in countries are wanting to sort of put their head into the sand and say, look, we want the good number. I think that there is a real desire to do more. And there's a lot of initiatives going on in the world, but they're sort of scattered and fragmented about, some of the water point mapping we're seeing and more precise monitoring that really is happening on either, the fecal sludge side, for example, or on the water quality side, although there is a risk of over-focusing on water quality because it only does tell us one element. So, we've talked in the context of the JMP and global monitoring about this ultimate desire to shift to national systems, which is a country behavior being espoused by SWA. So we've got to do that. But this is probably, beyond that health slide I showed you, the biggest, the most important slide, because we touched on this in the debate sort of last night or yesterday evening, and read that. It's very clear that countries need to sort of sit down and understand their national circumstances and adapt this sort of aspirational vision, right, for themselves, and that is that's going to take a real exercise in dialogue and in sensitization and communication, because many countries, this safely managed is an aspiration. But as we rightly heard yesterday, I think many of you were also quite understanding that it's out of reach for many. So why would you set a national target that's so catastrophically out of reach that you couldn't reach it? So that playing and understanding with the capacity you have in your monitoring system and your resources is going to be entirely clear. And I think if there's one thing that we can focus on, and I'll say as an international community, it's helping countries in this process, starting with their policies. So, safely managed water. This is where I get to compliment Australia, because many people over the years have taken credit for water safety planning, which I think is this really incredible thing. It's the heart of our guidelines. Individuals saying, I think I invented this in 1971 in a certain country, or institutions. But really, I think the impetus for this at an expertise and technical level came from Australia. And similarly, because of the support we've got from DFAT over the years, there's been some real incredible upscaling of this in South Asia, Southeast Asia, which has really led to kind of sharing of experiences all over the world. I think people have sort of seen this as a very adaptable tool to kind of move water from reactive to preventive risk management. And it's a big agenda. We've learned many lessons. But this, again, in essence, if you were to talk about the water agenda to a country, I would say, look, there's all this indicator stuff, but ultimately, at one level, you've got to think about moving to proper water safety planning and proper risk management to get this sort of safely managed process going. So safely managed equals WSPs. So some of the lessons that we've learned from the safely managed water, again, I think this sort of doomsday scenario of, we're going to look at the world and the world's going to be radically different and there's going to be so much water contamination, and what is happening is this. The positive thing is, let's hope policymakers will see that as an opportunity to do something about water quality and risk management. We've seen that in Ethiopia. They've done some really incredible things in terms of looking at the results of water quality tests and seeing, substantive amounts of improved water contaminated, fecally contaminated, and have responded with a WSP approach. So a wonderful kind of embrace of change in that particular country. The other, I think, lesson is that we need, in terms of we call it the water quality project with Australia, but we need to really work together, not only with water suppliers, but with regulators, because regulators need to be able to increase their capacity, going from a, let's interpret these tests, to an audit approach, and which is difficult and takes more, resources, takes more expertise. So that's the agenda on water. Now, on sanitation, again, when looking at the sort of readiness and looking at the safely managed kind of component of this, we've just, and this is just coming from Mali, right? So we have done a series of SDG sensitization efforts there. And they have one water treatment plant in Bamako. I believe it serves about 1.5% of the population. And, but they're very interested in extending that sewerage network, to make it work. And I think they're very interested and open to hearing about all the sort of different sanitation alternatives that we are kind of espousing here, including some of the fecal sludge management issues. So I mean, it's a new dialogue, but it's precisely that dialogue that we need to have. And when we were there, we're asking them, look, how much waste in terms of the sewerage is actually reaching a treatment plant and is being treated? And that kind of thought process is really, really valuable. And how much waste is emptied from pit latrines and septic tanks, right? And how much waste from pit latrines and septic tanks is safely disposed of on site. So going through that exercise, essentially using this fecal flow diagram as sort of a guiding conceptual framework, I think has been really useful. I had some fears. I think many people had some fears that, and maybe they could be proven right, but that this type of monitoring would be potentially too complicated, and it might kind of lend itself to, almost a rejection, because people love the black and white, improved, unimproved. I love it too. But at the same time, we need to move sort of beyond that. And I think that, this idea of countries, at least the ones we've talked to, saying we can't do this has not proven to be true. They have been looking to do something with it. But having said that, if we look at some of the, I'm sorry if you can't read this, but the GLASS report, which is a UN water report led by WHO that brings decision makers in countries together and asks them to self-report on a whole variety of kind of enabling environment factors. We talk about service performance on sanitation, and we talk about things like service quality and functionality, institutional effectiveness, and like the idea of what are you monitoring, what indicators are you using, what do you have the capacity to look at, what are you concerned with? And the numbers, you see it's hovering between 10, 20, 25%. So the issues that need to be kind of grappled with, in terms of the sanitation agenda, the safely managed sanitation agenda, are very, very sort of immature. And so a lot needs to be done on that. Now, I was very pleased yesterday at this whole health facility thing, and I'm sorry I'm leaving out schools for all the school folks and our UNICEF colleagues, but we had 2 sessions, really great sessions, and I want to thank the organizers for doing that and drawing some attention to this on health facilities. It's been really a sort of a journey into understanding this sort of, I would say, a catastrophe, and it's got to the point where I think if there's one thing we as an institution can do, it's sort of tackle this. And there's a role, many of you would sort of associate yourself with the wash sector. There's a role for the wash sector in this. So the numbers are bad, and you can see there that 40% of facilities, and this is I think in about 56 countries surveyed, don't have access to an improved water source. So essentially anywhere near within 500 meters of the facility. So that's, I think many people just sort of look at that and say, you can't run a health center with water that's half a kilometer away that may be contaminated. And then when you start looking at availability and treatment and all those other things, it just kind of gets worse. So what do we do, and sort of where do we start in terms of like kind of grappling with that agenda? And I just wanted to sort of pick up maybe sort of 2 points. And the first is that it's really that I feel like we have a catalytical role to play in terms of convincing our health sector colleagues that something can be done and that this is their responsibility and that we can help. We heard a lot about intersectoral collaboration. Within WHO, we're seeing, I would say, a lot of excitement and efforts to get this into a quality of care agenda, so either quality universal health coverage, quality care metrics for maternal and child health and good birthing environments, looking at the IPC agenda, so that's infection prevention and control. This was really driven by the Ebola crisis, actually, as a nice sort of kind of push to see, oh, look, all these health facilities are essentially not resilient to any sort of disease outbreak because, because of lack of hygiene and water and sanitation. So as far as the way forward, in these sessions, we talked a lot about monitoring, actually, and a lot about sort of country-level, facility-level monitoring, which is being done. But I think the key is to look at the health sector and look at how the management information systems are used on a regular basis in the health sector to define decisions. And I've stolen a little bit of Peter Harvey's slide from UNICEF, where he did a really kind of in-depth analysis of whether management information systems were used for health facilities. There actually WASH is in there, but it's not in enough detail to really show things like quality and cleanliness, nor is it kind of the information submitted regularly enough and reviewed regularly enough to make decisions. But it's a start. And I think so if we can get water and sanitation regularly paid attention to in these management information systems, I think we're going well. So just a couple of slides, and then I'll finish. But I wanted to come back to Katerina, and she gave us a wonderful speech yesterday about the exclusion, right? And imagining that person. Remember, we were all supposed to imagine someone that was excluded from WASH services. And this is a little bit of combining JMP and GLASS data. But Katerina mentioned that when she discussed with people, they didn't have a sort of systematic process for identifying disadvantaged groups. And we're finding, in terms of policy making from the GLASS data, that that's certainly not happening in terms of looking at, say, for example, pro-poor policies and applying them effectively. So we're looking at sort of less than 30%. So there's really a failure in policy and planning for disadvantaged populations. And you see, it's sort of simplified, but on the results side for JMP, that richer populations tend to get to about 100% coverage before there's a lot of progress made in the lower wealth quintiles. So we need to change that. We need to demonstrate that we can close that inequality gap before getting 100% access to the richest quadrant, the richest quintile. So this is my kind of last slide. And this circles back to Don's point. And that was about effective institutions. So he talked a lot about that, and that really kind of resonated with me. There's been a new study out by the World Bank, our colleague Guy Hutton, talking about how much it will cost. And I never really understand the billions of dollars thing. It's just so much. It's tough to really kind of understand what that means. Safely managed is going to be tough. I think we know that. But I think the thing is not to focus so much on the what it will cost, and they're suggesting 3 times the current amount of investment, but that we need to focus on the institutions and the leadership and the enabling environment. That will give us a good start here. So I'm sure I've left a lot of people out, but I just wanted to acknowledge all the great work that we're doing here and thank all of you for listening.